Good evening, I'm Robbie Alampay. The big stories tonight. As experts and citizens alike cast doubt on Russia's supposed vaccine, the country has started talks to procure Moscow shots. But the Department of Health says the vaccine still has to go through clinical trials here. Starting August 15, face shields will be required in the workplace. The Health Department has already issued a standard retail price to avoid overpricing. PhilHealth officials, one by one, exited the House probe on the alleged anomalies in the state insurer. Some of the executives who stayed, however, agreed to have their bank accounts checked by the AMLC. Not the best of starts for the Education Department's TV classes, as some viewers immediately noticed errors and accuracy issues. With a week left before the start of classes, printing of modules is not even halfway through for most schools. And already tired of your Zoom calls and meetings? Why not up the game with a life-sized hologram? This new device even allows users to interact with a recorded hologram of historical figures. Let's start with skepticism over the new Russia-registered vaccine against COVID-19. DOST officials are already in talks with Russian representatives for the procurement of the vaccine. Gerard de la Peña with the big story.
The Russian embassy announced that Moscow has developed a vaccine that would help prevent COVID-19 infections. In fact, the vaccine has already been registered in Russia. The embassy said even Russian President Vladimir Putin's daughter participated in the clinical trials. President Rodrigo Duterte hopes the Russians can make the vaccine available for Filipinos. But some citizens are apprehensive about the Russia-developed shot.
Para sa akin, parang hindi ko muna para sa akin kasi hindi ko pa nasubukan sa ibang tao.
Lumalabas sa FB po na maraming hindi ka daw pwedeng magpaturo kasi nga nakakamatay daw yung iba.
Health officials also clarified that Filipinos cannot be immediately inoculated with the vaccine once it reaches Philippine shores.
Even though dumaan na yan sa mga regulatory procedures sa Russia, pagdating yan sa Pilipinas, dadaan pa rin yan dito sa atin na mga procedure.
A panel of vaccination experts has informed the DOH of the various vaccines already under development. The DOST is already in talks with Russia's healthcare ministry for the procurement of the vaccines, but protocols for its clinical trials in the country have yet to be drawn.
We cannot really say kung sino at kung gaano kadami ang sasali. Kailangan din natin ma-determine ilan ba yung ipoprovide itong mga manufacturers, ilan ang papayagan na isali sa clinical trial dito sa ating bansa.
The Health Department has earmarked 2.4 billion pesos in the 2021 national budget for the procurement of vaccines for about 20 million Filipinos. Even other agencies like the MMDA have already set aside funds for the vaccination of their employees. Meanwhile, the DOH said the Japanese drug Avigan is already in the country. Clinical trials will begin soon, with 100 patients from the Philippine General Hospital, Santa Ana Hospital, Dr. Jose Rodriguez Hospital, and Quirino Memorial Medical Center expected to participate.
For News 5, Gerard de la Peña, we are One News.
Even Health Secretary Francisco Duque III is on the fence about Russia's supposed COVID-19 vaccine. The health chief says there are still not enough details on what Russian President Vladimir Putin calls the first registered coronavirus vaccine. Now tagged as Sputnik V by the Russians, the shots are still undergoing clinical trials. US-based group trial site has warned the Philippines to be cautious in trying out the COVID shots.
Duty of government is to ensure that it is safe to use and it is of quality. And we have the regulatory agencies to ensure that all those standards are met of safety, efficacy, and quality.
But if the country has to send someone as guinea pig for the test, it should definitely not be President Duterte. In an interview with Sa Totoo Lang on 1PH, Task Force Special Advisor Dr. Ted Herbosa said the chief executive is not qualified. He said high-risk vaccine trials are usually tested on individuals aged 55 and below.
Honestly, hindi siya qualified, no? Ako yung unang magsasabi, ay, huwag muna sa'yo. So give it to younger people with a strong immunity.
The country's COVID task force has started distributing free face masks, starting with modified ECQ areas. New workplace protocols have likewise been set to quell the transmission of the virus. Greg Gregorio tells us what these are.
The IATF has begun distributing free face masks, starting off with the Rizal province, which has the third most number of COVID cases in Calabarzon. It is also among the provinces placed under modified ECQ until August 18. As of August 11, Calabarzon has over 4,000 confirmed cases. National Task Force Against COVID-19 Deputy Chief Implementer Vince Dizon says they are prioritizing the poorest of the poor, as well as households with vulnerable members such as senior citizens.
Sa mga susunod na araw, i-distribute na ang mga free masks natin sa iba't ibang areas, starting with the areas na naka-MECQ.
Residents in Barangay San Roque, Antipolo City welcomed the initiative.
Malaking tulong po sa amin. Hindi na kami bibili ng face shield.
Malaking tulong po para sa amin po itong Christmas na ito kasi washable pa po.
Antipolo City Mayor Andrea Inares said they could use any help to prevent further coronavirus transmission.
Karamihan po ng nagpopositibo po dito sa amin ay mga taga-Antipolo na nagtatrabaho po sa NCR.
The task force targets to distribute 30 million face masks across the country. The IATF also sees this as an opportunity to help mask-producing MSMEs. Labor Secretary Silvestre Bello III announced stricter quarantine protocols in workplaces. He said the wearing of face shields will be required in the workplace beginning August 15.
Kasi yung contamination or transmission hindi lang naman limited sa ilong pwede rin sa mata.
Several employees have no problem with this.
Dapat sagot po talaga ng employer yun. Para hindi na rin dagdag sa gastos ng mga employee.
Protection mo na rin, and then protection din ng iba sa COVID-19. Yeah, I think it is very effective. Lalo na siguro kung may face shield pa siya.
Bello said employers shall provide the face shields. Recall that the IATF has also discouraged common smoking areas and dining in canteens and workplaces under MECQ. For News 5, Greg Gregorio, we are One News.
The Health Department is setting a retail price for face shields. Prices of non-medical grade face shields are set at 26 to 50 pesos a piece, although a 10% rise may be allowed for distribution costs to Visayas and Mindanao. Trade officials are warning sellers that they could face penalties for peddling overpriced products. They also encourage the use of DIY face shields.
Alam natin kung magkano ang presyo niya before nag-announce ang DOTR. Hindi siya 100 pesos, nasa 30, 35, 40 pesos lang yung binibenta nila ngayon na 100 pesos. So it's unfair and unconscionable and already a violation of the Consumer Act.
The House of Representatives has approved a new bill that sets standard health protocols. The Better Normal for the Workplace, Communities and Public Spaces Act of 2020 seeks mandatory wearing of masks, availability of hand washing or sanitizing stations, temperature checks, and physical distancing of at least 1 meter in all public spaces. More than 242 members voted unanimously to pass the measure. It is now up for approval in the Senate. Let's pause for a short break, but when the big story returns, it was supposed to be a moment of truth for embattled PhilHealth officials during today's House probe, but one by one, key agency officials left lawmakers hanging, citing medical concerns anew. And the family of slain activist Randy Chanis is hoping to get a glimpse of his body for the last time. The police are finally convinced the man killed in Quezon City earlier this week was indeed him. The details after the break. I'm Robel Ampay, watching The Big Story. COVID-19 cases in the country have surged to 143,000. More than 4,400 cases were added to the tally. 59% are from Metro Manila. Out of the total confirmed cases, around 72,000 are active. 93 additional COVID-19 fatalities were reported. That brings the death toll to 2,400. Total recoveries are nearing 69,000 as the DOH recorded more than 630 new survivors today. A House leader is daring PhilHealth officials to sign bank secrecy waivers to pave the way for an anti-money laundering council check. But even before he could respond to the challenge, PhilHealth President and CEO Ricardo Morales had to leave the chat room. Ria Fernandez tells us why.
House lawmakers continued to quiz PhilHealth over the alleged rampant corruption in the agency. Deputy Speaker El Rey Villafuerte dared PhilHealth officials to disclose their bank transactions to the AMLAC. Officials present in the hearing accepted the challenge, but Morales as well as EVP Arnel de Jesus and Legal Chief Rodolfo del Rosario Jr. eventually left the virtual hearing due to medical reasons. Meanwhile, House Public Accounts Chairperson and Anak Kalusugan Representative Mike Defensor reiterated that the so-called PhilHealth mafia thrived due to the agency's all-case rate policy, where PhilHealth pays hospitals on a package rate for a certain disease regardless if actual hospital fees are lower. Defensor noted that the Commission on Audit has time and again flagged the said policy since its implementation in 2013. Citing COA, the lawmaker added that PhilHealth also paid several hospitals despite the absence of claims. With this, Defensor is convinced that a collusion between hospitals and PhilHealth exists. He is also bent on filing plunder charges against PhilHealth officials down to those at the helm of its regional offices. In the same hearing, PhilHealth Senior Vice President Israel Pargas and Renato Limsiaco Jr. admitted receiving allowances out of PhilHealth accreditation fees made by hospitals. But when Deputy Speaker Dante Marcoleta tried to probe the amount, Limsiaco suddenly cleared himself.
Sorry po, talagang hindi ko matandaan po kung magkano yung pera po na binibigay po sa ating mga recipient po noon. Dahil po ako ay hindi po ako isang medical officer po, na binibigyan po ng ganong allowance dati po, Mr. Chair, Your Honor.
In defense, Pargas said the practice started in 2008 and was based on a board resolution. He said each of them received around 20,000 pesos yearly, but it was eventually disallowed by the Commission on Audit in 2014.
Kanina sinabi niya, meron silang monthly tinatanggap. Siya mismo nagsabi, naka-record tayo eh. Ngayon sinasabi na naman niya, hindi monthly. Paiba-iba ang sagot ng mga tao na yan.
At this point, some lawmakers were convinced that PhilHealth officials are just covering up for one another. With this, Deputy Minority Leader Carlos Zarate described the state insurer as having a failed system. Minority Leader Benny Abante ordered the agency to submit further details on accreditation fees paid by hospitals. The state insurer said it collected an average of 27 million pesos of the said fees for years 2018 and 2019. The House committees hearing the alleged fraud in PhilHealth will immediately issue a subpoena for the SALENs and ITRs of all involved agency officials. They will also release a show cause order against 3 PhilHealth officials, including Morales, who did not finish the hearing. For News 5, Ria Fernandez, We Are One News.
The Department of Health is defending PhilHealth's huge amount of cash advances to the Southern Philippines Medical Center in Davao. The Interim Reimbursement Mechanism, or IRM, for the said hospital is at 326 million pesos. That is higher than the Philippine General Hospital's 263 million pesos. But no comparison should be made, says Health Undersecretary Maria Rosario Vergere, as the said IRM was computed, she said, before the pandemic. The palace says it sees no irregularities in the allocation since SPMC is supposedly the country's biggest government hospital facility.
So kung sakasakaling mas mataas, baka yun ay kadahilanan ng kalakihan ng kanilang ospital, maraming beds, maraming pasyente. Pangalawa, high technology rin sila and they cater to different or varied types of patients.
In the upper chamber, senators are proposing to suspend PhilHealth's IRM until the agency's anomalies are resolved.
When you release public funds, may pre-audit yan, tsaka post-audit. Hindi yan pwedeng iparada lang doon na wala pang plano kung saan gagamitin yung pera. And kaya kailangan magkaroon po ng formula o talagang hakbang na masisigurado na itong pondong ito hindi masasayang at hindi nanakawan.
Task Force PhilHealth is set to meet on Friday to lay out their strategy. Headed by Justice Chief Minerva Guevara, the task force is composed of representatives from the DOJ, the Office of the Ombudsman, the Commission on Audit, the Civil Service Commission, and the Office of the President. Resource persons will be invited to brief task force members on the alleged irregularities in PhilHealth. The meeting will be held at the DOJ headquarters in Manila, but members can participate via video conference. And these are the other big stories today. The Health Department is combing all cities in Metro Manila to find the barangays with the most number of COVID-19 cases. Emerging as high-risk areas are Batasan Hills in Quezon City, Fort Bonifacio in Taguig, Pembo in Makati, and Addition Hills in Mandaluyong, among others. The Coordinated Operations to Defeat Epidemic, or CODE program, aims to mobilize communities. Interior Secretary Eduardo Año says he will file criminal charges against individuals or groups behind a false and malicious information being attributed to him. Año is referring to a manipulated CODE photo with a statement suggesting for couples to practice social distancing after having intercourse. Transportation Secretary Arthur Tagade has ordered railway authorities to absorb Light Rail Manila Corporation's laid-off workers. Tagade instructed the Philippine National Railways, Light Rail Transit Authority, and the Metro Rail Transit Line 3 to hire the retrenched employees. LRMC rationalizes staffing as ridership dropped by 90%. The family of slain activist Randy Chanis hopes that his body will be finally released. This after a fingerprint exam proved that he was indeed the man killed in Quezon City last Monday. Ryan Ang with a full story.
Police officers on Wednesday prevented the holding of a holy mass in front of the Pink Petal Memorial in Quezon City, where the body of activist Randy Chanis is being withheld. They said mass gatherings are not allowed in Metro Manila under the prevailing quarantine restrictions. Because of this, a solidarity prayer was offered for Chanis instead.
Kahit na meron tayong health protocol measures na ginawa katulad ng physical distancing at nag-alcohol naman tayo, and I'm sure lahat naman dito ay ayaw magkasakit, hindi tayo nakapagmisa ng full-blown.
Chanis' wife Erlinda is hoping that authorities will release the body on Wednesday after the results of the fingerprint cross-matching exam came out positive.
Ang hinihintay na lang natin ay madala siya for autopsy.
The Quezon City Police District earlier identified the body as Manuel Santiago based on an ID recovered from the crime scene. On Monday, they intervened during the cadaver's transfer, bringing it to another funeral home due to a supposed lack of a release order. Authorities also arrested a paralegal staff who was guarding the body. In a press con held earlier today, the QCPD apologized to Echeni's family for the delay in the release of the cadaver, saying they are just making sure that the real family claims the dead body. In a statement, the Free Legal Assistance Group condemned the killing of Chanis and the person alongside him named Dewey Tagapia. The group also expressed outrage at the police for allegedly snatching the body of Chanis from his family. For party list Gabriela, the killing of Chanis, who was the peace consultant of the National Democratic Front of the Philippines, has implications in the socio-political condition of the country.
Kung paanong ang mga naninindigan lumalaban kaiba or oposisyon ang pagtindig sa mga usapin sa pamahalaan, usapin sa ating bayan ay hindi napapakinggan at pinapatay. Malaking usapin po yun.
Ross has added that the case may reach human rights offices outside the country due to its severity. For News 5, Ryan Ang, We Are One News.
Coming up on the big story, senators are urging DepEd to rethink the opening of classes on August 24, at least in areas under modified ECQ. But the Education Department insists they can't just do that. And forget Zoom, a Los Angeles-based company is taking virtual meetings to the next level via life-sized holograms. More of that after this short break. This is the big story. I'm Robbie Alampay. Senators do not see the feasibility of pushing through with the start of classes on August 24. This as the printing of modules is lagging behind schedule. The Education Department's response in this report by Mean Los Baños.
In a few weeks' time, students will go back to school via hybrid distance learning. But with Metro Manila and nearby provinces still under MECQ, senators worry that teachers will not have enough time to distribute learning materials.
Pero paano natin gagawin yun if the situation is worsening? Yun ang punto ko eh. And we don't have any way of predicting after August 19 kung mag-i-improve o hindi mag-i-improve ang situation.
Senators now urge the Education Department to recommend to the President the postponement of the opening of classes as allowed by a newly signed law.
Na kaya ho in-enact itong bagong batas natin, itong RA 11480, is para kung nag-worsen ang situation at lumala talaga yung sitwasyon, meron tayong ganitong batas na pwedeng magbigay ng flexibility.
Even the League of Mayors recommends the same. DepEd explains that while they're making adjustments to ensure the safety of teachers and students, they cannot just suspend classes every time an area is placed under stricter quarantine.
Direktiba po ng ating Ma'am Liling Briones ay doon po sa mga lugar na diniklarang MECQ, wala pong pamamahagi ng mga self-learning modules o retrieval na mangyayari na ating pong ini-envision when we do the PhilHealth and the way we are articulating it for the first 2 weeks.
The agency believes they have ample time to distribute modules given that the first week of classes will be spent for orientations and psychosocial assessments. According to the DepEd, 33% of schools are already halfway through in printing first quarter modules. But 61% have yet to reach half of their printing. Senators question if all materials will be printed before school starts in August 24.
Pipilitin po natin na mapag-over 50% lahat. But as I mentioned, the priority is to have at least the first 2 weeks available on August 24.
DepEd data shows that 23 million students have enrolled higher than the projected 22 million enrollees. But a group of private schools fear they won't even reach half of their normal rate.
Marami po kaming mga private schools who are ready, well-equipped, better po sa technology yan dahil even before the pandemic, meron na po silang online learning. But unfortunately, because of the lack or very low enrollment, all of these technologies will be underutilized.
The DepEd said enrollment in private schools dropped by 2.8 million, while public schools lost 1 million enrollees. The agency also recorded 4 million out-of-school youth learners this school year. Reporting for News 5, Mean Los Baños, we are One News.
The Alliance of Concerned Teachers suggests moving the opening of classes to January 21. Speaking with One News, the chiefs, ACT Secretary General Raymond Basilio said this will give the education sector more time to prepare. Basilio adds that only 40% of teachers underwent rigid training for different modalities in teaching.
Sinasabi nila ay papahiramin ito ng computers kasi meron namang available na 100,000 items o units ang Department of Education. Pero nagtataka kami kasi magbubukas na po yung klase sa 24 ay hindi pa po ito na ipamimigay sa ating mga guro.
After a bad start with accuracy issues, the DepEd is now vowing to polish the content of its TV classes. A look at their test broadcast in this report by Marian Enriquez.
The Education Department has begun the test broadcast of TV classes that will be used to supplement the implementation of blended learning. But early on, some already noticed accuracy issues. Some parents are now calling on the DepEd to correct the errors.
Sana po maayos po nila yung mga content po sa mga DepEd po, ganun. Para po yung mga bata may matutunan po.
The Catholic Educational Association of the Philippines welcomed the DepEd's test broadcast, saying this will be a great opportunity for the agency to improve the project.
It will have to pass through the rigorous process. Kasi nga education ito dapat ang tinuturo natin ay tama. So yun, kailangang improve yun.
Arellana also stressed that the errors do not necessarily validate the move to further delay the opening of classes, as what some groups are lobbying.
Marami ng school year ako nakita na paulit yung question sa preparation ay laging nandyan. When will we ever have a perfect school year? Hindi mangyayari yun till kingdom come.
The DepEd acknowledged the errors in their content but clarified that the broadcast is still in its testing phase and that nothing's final yet.
Ang focus namin ay nasa technical aspect, wala dun sa content.
Pasqua vowed that the agency will continue to polish their content before the start of the official broadcast.
We are now really exerting efforts to quality assured every and all of the episodes that we will be showing come August 24.
Pasqua added that the DepEd is planning to put up a hotline where the public can report the errors. The agency is currently in talks with various networks, such as Signal TV, to carry its programs in addition to Solar Learning and IBC 13. They're also looking for additional teacher broadcasters. Materials to be aired on TV and radio will be uploaded to the DepEd Commons, the agency's online platform for the easy access of students and teachers. For News 5, Marian Enriquez, we are One News.
Let's take a quick look at some of the world's biggest stories. Democratic presidential candidate Joe Biden has named California Senator Kamala Harris as his choice for vice president. Harris' selection comes after Biden committed to picking a woman to joining him on the Democratic ticket. This makes Harris the first Black and South Asian American woman to be named on a major party ticket for the presidential elections. New Zealand has shut down Auckland after reporting 4 new COVID-19 cases. The fresh infections are the first evidence of domestic transmission in the country after having been virus-free for 102 days. And a U.S. court has ordered Apple to pay more than $500 million in damages and interest to Panoptis, that's an intellectual property company, for 4G patent infringements. Panoptis took Apple to court in February 2019, claiming that the latter refused to pay for the use of the technology in its smartphones, tablets, and watches. And are you getting tired of Zoom meetings? How about talking to life-size holograms instead? A Los Angeles-based company has developed phone booth-sized machines that could project live holograms into your room. The device, created by Portal Incorporated, lets users talk in real time with life-sized holograms of another person. The machines can even be programmed to enable interaction with recorded holograms of historical figures or people who have passed away. Prices for the machines start at $60,000, but that's expected to drop over the next 3 to 5 years. And that wraps up today's big story. Catch us again tomorrow, 8 p.m., Signal Channels 8 and 250. Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph. You can also catch One News on the Signal Play app. Register for our free account now at signalplay.com and stream One News live anytime, anywhere. I'm Robbie Alampay, and we are One News. Good evening.